Welcome back. Today again we are going to deal with the chapter health and diseases. So student, in the previous lecture, that is previous video, we had learned about definition of health, what is diseases, types of diseases and some infectious diseases, its mode of infection, etc. So today we are proceeding ahead with some more interesting topic. Okay, now what is infectious diseases? Diseases spread through contaminated air, water, food or vectors. In vectors may be insect and other animals are called infectious diseases. Now we will learn something more about infectious diseases. Some important diseases of present day. Before that, let me ask you some questions. Can you tell me how can we observe personal hygiene? Okay, we can observe personal hygiene by brushing teeth twice a day, having a bath, cutting nails, wearing clean clothes, etc. Why should we drink boiled water in rainy season? So, during rainy season, there are many germs present in water. Most of them are diseases causing pathogens. Hence, we should drink always boiled water. Why the clean hands drive is run in schools? So, the Clean Hands Drive is run in schools in order to maintain personal and community hygiene. So, first infectious disease is dengue. Let's see about dengue. What is dengue fever? Dengue fever is an illness caused by infection with a virus transmitted by the Aedes mosquito. Have a look about Aedes mosquito. Symptoms of dengue fever: fever and headaches. There will be muscle and joint pain, severe abdominal pain, persisting vomiting, difficulty in breathing and diarrhea. Mosquito lay the eggs in the waterlogged places and thereby their population increases. Different species of mosquitoes spread different diseases. Dengue is spread by Aedes aegypti. This disease is caused by Den-1-2 virus belonging to the type flavivirus. How it is cured? By removing stagnant water. As you can see one picture of a tire, and inside that tire some water has been locked. This logging of water may be due to rainfall or some other reason. But as soon as any places, if the water is logged, mosquitoes lay their eggs and thereby their population increases. So, try to avoid such cases where the possibility of water logging. This will avoid the chances of spreading the disease which is caused by the mosquitoes. Different species of mosquitoes spread different diseases. Dengue is spread by Aedes aegypti. This disease is caused by Den-1-2 virus belonging to the type flavivirus. As you can see in the image, there is a picture of a virus, dengue virus, that is flavivirus. Students, you have an activity on page number 8 of your science textbook, that is reason and preventive measure. As you can see, first there's a reproduction, breeding of mosquitoes in tank. Urns and utensils, accumulation of water in man-made containers, cause breeding of Aedes mosquito. Water cooler, infection to babies. Then guppies can control the larvae. Fumigation by insecticides. And the last, using mosquito coils to repel them. Students, these are the answers of activity 2.1. Please pause the video and note down into your notebook. Do you know, students? Malaria is caused due to female Anopheles, while elephantiasis due to female Culex. Anopheles and Aedes grow in clean water, while Culex in dirty and sewage water. Now, student, our next infectious disease is swine flu. Students, what are the reasons for spread of swine flu? Answer: swine flu is caused by the virus influenza A, that is H1N1 virus. Its carrier is pig. The contact with such pigs or infected person means the person who is already suffering from this disease can cause infection of swine flu. Virus of swine flu are also spread through sweat of infected person. Similarly, it is spread through secretion of nose, throat and saliva of a infected person. Now, let's see symptoms of swine flu. First, patient is going to face difficulty in breathing. Secondly, the patient is going to have a sore throat. Sore throat means a condition marked by pain in the throat, typically caused by inflammation due to a cold or other virus, and the patient may be suffering from a body pains. Now, how to do a diagnosis of a swine flu? For diagnosis of a swine flu, liquid from throat of a patient is sent in laboratory. Diagnostic facilities are available in National Institute of Virology, that is NIV, Pune and National Institute of Communication Disease, that is NICD in Delhi. Do you know, students? First case of swine flu was reported in country Mexico in the year 2009. Swine flu is caused by the virus influenza A, that is H1N1 virus. Persons who come in contact with pigs can contract this disease. Students, our next infectious disease is AIDS, that is acquired immunodeficiency syndrome. This disease is caused by HIV, that is human immunodeficiency virus. In this disease, victim suffers from various diseases due to progressive weakening of natural immunity. Diagnosis of AIDS cannot be confirmed without test in medical laboratories. ELISA test is used for its proper diagnosis. Symptoms of AIDS is person specific. Always remember, children, AIDS do not occur due to touching and sharing the food with HIV infected person. or by nursing the HIV patient. Our behavior with HIV infected person must be normal. When blood transfusion is done, the blood should be checked for the presence of HIV. The used syringes, needles, etc. should not be used without sterilization. Through blood and blood products and body fluids, HIV finds its way into our body. Therefore, these precautions should be taken. Unsafe sexual contact is the most dangerous, important mode of transmission of HIV. Thus, one should never deal with such dangerous acts. Awareness about AIDS and HIV is the real preventive measure. Do you know, children? Now, children, we will see. Do you know, children? HIV was first reported in an African species of monkeys. According to the National AIDS Control Program and on AIDS, that is UNAIDS, 80 to 85% HIV infections in India occur through unsafe sexual contacts. Now, children, we will see infectious diseases through animals. Infectious disease through an animal is rabies. Rabies is a viral disease. The bite of a rabid animal, that is the animal who is already infected with rabies virus, transfer the virus in the human blood through the bite wound. Dog, rabbit, monkey and cat can be infected with rabies if they are not vaccinated. The virus of rabies enters the brain through neurons. If not treated in time, rabies can be fatal. Hydrophobia is one of the important symptoms of this disease. Hydrophobia means fear from water. The patient who is suffering from this disease is going to develop this symptom, which he or she can feel extreme fear from water. Rabies is a fatal disease. However, fatality can be prevented by timely vaccination before onset of symptoms, means before occurring of symptoms. Symptoms start to appear within 90 to 175 days of dog bite. Now, let's see what are the symptoms of rabies. The patient may suffer from fever for 2 to 12 weeks. The patient may develop exaggerations in behavior, that is, to represent something as more extreme or dramatic than it really is. Next symptom is hydrophobia, that is, fear from water. Students, today we will stop here. In the next upcoming video, we are going to learn about non-infectious disease. So if you don't want to miss the interesting video on non-infectious disease, so don't forget to subscribe my YouTube channel. And yeah, if you like it, please share it. Till then, take care. Bye bye.